The need to preserve the environment calls for a multi-sectoral approach, which calls for the involvement of government, civil society, the private sector, and academia, among others. As part of the preparation,
a report of the Parliamentary Committee on HIV, AIDS and other associated matters on the assessment of the high HIV prevalence rates and accessibility of HIV self-delivery in police detention centers and prison facilities indicates that HIV prevalence is higher than the national average of 5.4%. The report shows that in Dianga prison in Chiriandongo district, the facility recorded 18.7%, Gulu main prison 18.6% and Kitgum prison 10% HIV prevalence respectively.
But one thing that is clear is that the majority of these people are ignorant that they have HIV until they are tested on entry.
The report of the Parliamentary Committee on HIV corresponds with the Uganda Prison Behavioral Survey of 2019, which revealed that HIV prevalence among prisoners was at 15% and 12% among prison staff. The report attributes this to risky behaviors and lifestyle.
One starts with carelessness. There are those, even after being told what brings HIV, who don't listen. For example, if we say don't share the razor blade, and somebody decides to pick a razor blade that has been dropped and uses it, sometimes you cannot know because this is a personal choice that the person has done. That's one. Two, there are those who come from out and they are homosexuals. If they come as partners and continue, therefore they will do what? They will get it, whether they want it or not.
It's because the lifestyle that leads them to be taken to prison is probably responsible for why, because as you've heard, more than between 65 and 70% of the cases are due to defilement, and which is a sexual related offense. So it's no wonder that the HIV prevalence amongst prisoners is high.
Renowned specialist in HIV treatment, Dr. Watiti, is of the view that HIV treatment interventions be strengthened in prisons to suppress the viral load for those infected.
And if the person who is positive is virally suppressed or the viral load is suppressed, the risk of the negative person is very low. We say undetectable is untransmittable. So the person who is negative should not run away from his or her positive partner. He can support them and they live together and even have children.
However, the spokesperson of prisons, Frank Baine, confirms that there is on-entry HIV testing and those found positive are enrolled on treatment, but there is still a challenge of adherence as some fail to swallow the medicine. The Uganda Prison Service has a prisoner population of 71,354 with an occupancy rate